Hi, my name is Heather Bays, and I'm a foster parent of 16 years. For today's episode of BC Foster Basics, I would like to talk to you about care plans for children and youth. The standard for foster homes, C1, Comprehensive Plan of Care, now called Care Plan, states that each child or youth is entitled to have a written, individual, comprehensive plan of care which has been developed in consultation with caregiver, the child, and where possible, their parents. You may hear or read about care plans referred to by a couple of other different names, Plan of Care or CPOC. The name of the document was recently changed to Care Plan, and the written policies are in the process of catching up. Along with the new name comes a new design which we will explain more about in a few minutes. Why do we do care plans? A care plan is used as a planning document to set goals and to provide an ongoing guideline for the child's day-to-day care, assessment, and development while in foster home. It also provides a written record of the child's life in care. We create care plans for each child because we are responsible for ensuring that each child has the best chance for success. As a care team, we are accountable to the child. That accountability is related to supporting and facilitating positive relational connections, resilience, healing, and permanency outcomes for the child or youth in care. The content of each care plan is entirely individual, although the format is the same. When are care plans done? It's expected that the care team has completed an interim care plan within 30 days of the child coming into care. A full care plan is completed within 6 months of a child coming into care and is formally reviewed and updated after another 6 months. This timeline has changed. Care plan reviews used to take place every 3 months. Who takes part in completing the care plan? The development of the care plan is the responsibility of the child's care team. Ensuring the completion of the care plan is the responsibility of the child's social worker. The plan is developed in collaboration with the child's care team, including caregiver, family, cultural community, and both the child's and the foster parent's social worker. Whenever possible, have your resource worker attend to support you at these meetings. All care team members have valuable information that supports the development of the plan that meets the needs of the child's current situation. As a foster caregiver, it is imperative that you are an active participant in the development of the care plan, as you are often the primary person responsible for implementation of large parts of the plan. Before signing the plan, be sure to understand and agree what is being asked of you. You are expected to accept responsibility for only those aspects of the care plan that you are capable of carrying out. How do I participate in creating the care plan? In your role as foster parent, you likely have a great deal of insight and knowledge about the child in your care. This information is valuable to the development of the care plan. As a member of the care team, you will be asked to provide information that includes identifying the child's unique developmental, emotional, and behavioral needs, identifying any need for new or additional services, representing the child's needs and viewpoints to the other care team members, or supporting the child in expressing his or her own views, recommending a review of the care plan if it seems appropriate, encouraging the child to participate in planning for his or her future, encouraging the child to participate in suggested community programs, and developing programs within your home that meets the child's specific needs. Prepare for the care plan meeting by reviewing the document called Preparation for Care Teams or Care Planning for Caregivers. This document is available through the BCFFPA website. The Ministry has provided some helpful tools in order to prepare a child or youth to work with the care team on the care plan document. These tools are available at BCFFPA's website and are called Guide to Conversations. These are for the child's worker to use, but are interesting to read and see what topics and questions are going to be asked and discussed. The resource tool titled Skill Guide for Self-Care and Independent Skills is useful for social workers and caregivers when focusing on the child or youth's skill development. What action do I take when the care plan is complete? The standards for foster homes states that the foster parent must be aware and keep track of the child's progress and the desired outcomes outlined in the care plan, the child's current functioning in health, education, identity, family and social relationships, social presentation, and emotional and behavioral development. Be sure to monitor your own capacity to meet the responsibilities outlined in the care plan, and any concerns you have with the compliance need to be addressed immediately with your resource worker and with the child's worker. What do I need to know about the care plan document? The care plan document is a standard format that assists the care team to focus on the child's needs and best interests for assessment and planning. The care plan document is based on an assessment of the child's or youth's strengths and needs. It is divided into 5 developmental sections and has 2 additional planning sections that documents the child's assessment and plan, as well as measures the child's progress towards the goals and positive outcomes. The sections or key domains of the care plan document cover the following topics: identity, physical, emotional, and behavioral development under the topic of health, education and social recreational activities, placement and living arrangements, and self-care and independent skill. Each one of these domains has a further breakdown of topics relevant to all aspects of a child's identity, history, care, and development. Recognizing the importance of these documents, MCFD staff and caregivers are working diligently to meet compliance expectations and ensure these care plans are done for the children and youth that we all serve. Just a few hints on what will make this an easier process for you as the foster parent. Remember, when you do this is a document. Read and agree to everything before you put your signature on that piece of paper. You need to know that you can do this. When you are going in to do this, make sure you bring your day timer. You need to know when the last appointments were and when the upcoming ones are. Bring any documentation that you have that has not already been received by the social worker or the resource worker, such as the most recent monthly report or a recent report card, anything that will help you. Bring a list of things that your family does generally as activities, such as snowboarding or water skiing or quadding. All of these might be considered a slightly high risk, and if they're in the care plan, you're covered. In the long run, there's lots more that you can do to help. Talk to other foster parents. We all have the different ways of doing this. But the more information you have and you bring to the table, the easier this document is to develop. I hope you enjoyed this segment of BC Foster Basics. If you need further information or assistance regarding care plans or any other fostering subject, please call us at 1-800-663-9999 or check out our website at bcfosterparents.ca. Also, please don't forget to visit the BCFFPA YouTube channel regularly for more topics in the BC Foster Basics series. Topics such as agencies at your service, self-care for caregivers, and many more.